Hello, in this video, let us look at the previous year question of anatomy down here below. So they are asking you for 5 marks. Describe the movements of the scapula, the muscles causing them, right? Explain the anatomical basis of winging of scapula. So what and all they are asking you? Scapula, the movements of the scapula, the muscles which cause these movements, and then the anatomical basis of winging of scapula. 2 marks for the movements, 2 marks for the muscles, and 1 mark for the winging of scapula. Why does winging of scapula happen? So one great thing is winging of scapula is not a movement of scapula. So please note that. So let us look at the movements of scapula now. Okay. So here are the movements of scapula. So now you will practice with us. Elevate the scapula, depress the scapula, protract the scapula. Protract means you have to forward punch that person. Punch somebody in front of you. Punch that person. That is protract the scapula. Then retract the scapula. When you retract the scapula, it actually causes squaring of your shoulders. If both the scapulae you retract, what will happen? If both the scapulae are retracted, your shoulders will become square. So it is called as squaring of shoulders. And what exactly are you doing here? Retraction of both scapulae. So retraction of scapula. Okay, that is squaring of shoulders. Then lateral rotation. Okay, lateral rotation means overhead abduction of arm. What is this? Overhead abduction of arm. And then you have the medial rotation. Okay, medial rotation of scapula means the arm, you make it go behind you and let it fall due to gravity. That will become medial rotation. Okay, so here you can see 2 red arrows, right? These 2 movements are actually using gravity. Which one? Depress the scapula is using gravitation, and medial rotation of scapula also is using gravity. Okay, so now let us practice again the movements of scapula. Come on, you can say elevate the scapula, depress the scapula, protract the scapula, retract the scapula, lateral rotation of scapula, medial rotation of scapula. Okay, so look at the actual movements. If you have to describe what is happening, what will you say? You're elevating the lateral border, you're depressing the lateral border, your lateral border is moving forward, lateral border is moving backward, kind of a thing. Lateral rotation of arm means overhead abduction of arm, and medial rotation is just the opposite. Okay, so this much you can explain. Movements are done, guys. And where is squaring of shoulder? If somebody asks you where does squaring of shoulder happen? When you retract both your scapulae. Very good. Now movements are done. Okay, so what are the movements that you will write? You will write elevation of scapula, depression of scapula, protraction of scapula, retraction of scapula, lateral and forward rotation of scapula, medial backward rotation of scapula. Where does squaring of shoulders happen? Focus here. Focus. Where is squaring of shoulders? Retraction of scapula. Okay. Now let us look at the next part of the question, that is the muscles causing them. Okay, there's one more diagram here from the textbook showing the movements. So let us look at these. Elevation of scapula. See, lateral border only they have marked. Depression of scapula, protraction of scapula, retraction of scapula. This will cause squaring of shoulder. Then you have the forward or the lateral rotation of scapula, medial or the backward rotation of scapula. Very good. Now let's go to the next part, the muscles. Okay, so all the muscles that you need to know are here. Okay, let us say you want to elevate the scapula. Elevate scapula means you need some muscles which are here. That means what? This is upper trapezius. Trapezius has upper, middle and lower. Look at that. Okay, upper, middle and lower. It has only the upper one you are using to lift the elevate the scapula. What else can you use? This one, levator scapulae also. Levator scapulae also can help in elevating your lateral border. So, can you tell the muscles used for elevation of scapulae? Elevation of scapula, levator scapulae and upper fibers of trapezius. Very good. Next movement, you want to depress. See, depress means you can just say gravity. Okay, that much is enough. But let us see. Now let us move on to the next one, third one, protraction of scapula. That is, you want to punch the person in front of you. That means it has to move forward. If it has to move forward, something in forward only. muscle, that is serratus anterior. It will take it forward, right? Serratus anterior, right? Then for forward. So along with one more anterior muscle they have written, you're punching somebody in front of you. For that you need serratus anterior and pectoralis minor just to move the scapula, remember. Other muscles will be there to punch somebody, but for scapular protraction you need serratus anterior and pectoralis minor. Now let us go to retraction of scapula. Retraction of scapula, squaring of shoulder. Okay. What do you think will be required for that? Don't worry, it is very easy. Look at the movement. The movement is something like this, right? So which muscle is there here? They have shown upper part of middle fibers of trapezius I'm seeing, and then rhomboid minor and rhomboid major. Okay, so I will say that it is middle fibers of trapezius, rhomboid minor and rhomboid major. What will you say? Let us see what the textbook says. Retraction of scapula, which causes the squaring of shoulders, rhomboids and the middle fibers of trapezius. Very good, people, very good. Now let us go to lateral or forward rotation of scapula. Now, if the scapula has to move something like that, I would say that I would need something in front, that is serratus anterior. Definitely I need that. And some pectoralis minor also, is it? And do you need some amount of elevation also? So you may need levator scapulae and upper trapezius also. What do you think, guys? Okay, so they are telling only two things. They are telling upper fibers of trapezius and serratus anterior. Levator they did not tell. Okay, levator they did not tell. What and all they told? Upper fibers of trapezius. Put your hand above your head, overhead abduction of arm, lateral or forward rotation of scapula. You need, can you feel the upper fibers of trapezius? Can you feel the serratus anterior? Yeah. Okay, but don't feel the levator scapulae. Okay, very good. Now let us go to the last movement, that is medial or backward rotation of scapula. That I already told you, you need gravity and your hand has to go behind, right? Your arm. So what and all you need? Gravity. Yes. Interestingly, they're telling levator scapulae and rhomboids. Why do you need? I'm not sure why you need levator, you know, are you? Anyways, this is what I want. Medial rotation. So I'm very happy to say that it is gravity pulled. Okay. See, when it has to come like this and like this, I would say some other muscles. But anyways, gravity is our best choice here. Elevation of scapula. Revise this. Come on, guys. Elevation of scapula, upper fibers of trapezius and levator scapulae. This makes so much sense because it's elevation of scapulae, levator scapulae makes sense. Depression, we'll go with gravity. And protraction of scapulae, if somebody says just punch them, remember. And how will you punch them? You will use the forward muscles, right? So you will use serratus anterior and pectoralis minor, okay? Pectoralis minor was not there in the diagram which I showed you, remember. Retraction of scapula, that means you want to square your shoulders. That means you will use rhomboids. Rhomboids, very good. And the middle fibers of trapezius, no confusion there. Overhead abduction of your arm, lateral or forward rotation of the scapula. You need to do what? You need the upper fibers of trapezius and the lower fibers of serratus anterior. It's a forward. Whenever they say forward rotation of scapula, serratus anterior will always come in forward movement, remember. And you can guess the trapezius because you're kind of taking it above, right? Okay. Coming to medial. Medial, I'll go with rhomboids and gravity, a lot of gravity. And medial, I'll go with a little rhomboids only and gravity, okay? How's it going, people? Muscles also done now. Now let's go to the last part of the question. Do you remember the last part of the question? Explain the anatomical basis of winging of scapula. And winging of scapula, if you observed, was not there in the movement. It's not a movement of scapula. Winging of scapula is not a movement of scapula. It is a clinical condition. Okay. So they're asking the anatomical basis. So the first thing you will tell is, look at this diagram here. This is the normal thing. They've shown the serratus anterior. Okay. Do you know this is the serratus anterior muscle? What it does is it will help in keeping this medial border of the scapula in line with the thoracic cage. Okay. So it will not protrude. But in this guy, you can see that it is protruding. Why? Because serratus anterior is not able to pull that medial border of the scapula. So it has become winging of scapula. Okay. So this is red. Remember, this is winging of scapula. This is a clinical condition because of the paralysis of this muscle, that is the serratus anterior muscle. And why did this muscle get paralyzed? Because the nerve which supplies this muscle, that is the long thoracic nerve, is injured. Okay. So now let us look at the normal anatomy that they are mentioning here. Let me put that in dark green. Normally the pull of the serratus anterior muscle keeps the medial border of the scapula against the thoracic wall. Okay. The muscle serratus anterior keeps this medial border of the scapula against the thoracic wall. Now what happens in this swinging of scapula, the serratus anterior muscle is paralyzed. Okay. So what will happen? Why is it paralyzed, the serratus anterior muscle? Because of the injury to long thoracic nerve. So what is happening? Winging of scapula is happening. So what happens in this case? He cannot protract the. See, in this case, he's trying to punch somebody in front of him, right? That hand is in front, right? So this is a protraction movement. So in this movement, what should have happened? Protract. This is a forward movement of scapula, right? That is not there in this. Okay, so protraction is not happening. So he cannot punch somebody in front of him. Remember, he cannot punch you with his right hand, but left hand he can still punch you, right? In this case, so don't think that he cannot punch you and all that. So protraction is affected here. I'm trying to write a P here. He cannot punch you. Why? Because serratus anterior is the muscle that is affected. Okay, and this is called as boxers or swimmer's palsy. Boxer, obviously, because boxers will have to punch. So this is boxer's palsy. Okay. So if you want to ask the patient, just ask him, put his hands in front of him like this and stand probably against a wall or something, and then you can just go behind and look. He'll have this medial border and the inferior angle. Medial border and inferior angle will be prominent on the affected side. Okay. So this is nothing but winging of scapula. So inferior angle and the medial border of the scapula are prominent. The patient cannot push, okay, on that side. He cannot abduct the arm beyond 90 degrees, that he cannot take his hand above his head. So maximum he can go only so much, looks like, okay. And any movement you will ask him to do will make these two prominent. That is the medial border and the inferior angle. Very good. Winging of scapula occurs in paralysis of. Winging of scapula occurs in the paralysis of serratus anterior muscle. The nerve injured and the clinical signs. Come on, focus. The nerve injured and the clinical signs. Nerve injured is what? Long thoracic nerve. Muscle affected is serratus anterior. And the condition is winging of scapula. Okay.